Hello, everybody. This is Piekartz from Holland, physical therapist, and specialized in craniofacial pain and cervical region. So I'm very thrilled for my invitation in Orlando this year. And my workshop on Thursday, 4 May, goes about the craniofacial pain and the clinical solution for complex presentation. I want to show some patients, and we want to discuss it and the background, what we can do on the best evidence in these patients. For instance, I'll show you a patient with a B-maxillary operation and all the contributing factors and how we can solution this. The second part goes about craniofacial pain, dominantly on the cranial neuropathies. And I want to introduce you a clinical classification, what may be useful for our daily life on the background of the evidence at this moment. And then on 6 May, I'm very keen to do the presentation on unrevealing the orofacial cervical complex. And this is a lecture where I will to be focused on the neurophysiological anatomical model about pain related with the brainstem, especially with the trigeminal cervical nucleus, where we discuss long-term orofacial nociception, what happens in the cervical spine, and controversy. And we go more in depth what happens in the brain on the best evidence we have, but also we discuss what happens in the brain and why it is so complex to assess it on a very valid way. So we discussed the orofacial nociception and the influence on the craniocervical region, what has this for clinical implications, and also controversy when there's a long-term cervical dysfunction and the consequences for the orofacial region in assessment and treatment, especially for physical therapy, but also for dentistry. So we have some questions over here, and we want to discuss this, what we can do in daily life. Afterwards, I want to give an overview of the evidence about the treatment and assessment of orofacial cervical complex and some clinical cases to support it, and what are our clinical challenges for the future. Of course, we have a lot of things to do in this area. So we did the last 5 years in scoping review, and I want to give the results we have at this moment and what it means for our clinical treatment possibilities in dentistry, but also in orthopedic physical therapy. So I hope to see you soon in Orlando on the Academic Orofacial Pain Scientific Meeting 4 till 16 May in 2023. So I'm looking forward for it. I see you. Bye.